So we're with Stuart Ray and Millie Morrison. We've just finished a long 2 days training dentists on composites. But I wanted to talk to you two about your journeys and what's working for you guys now and where you've come from and where you've gone to. So Stuart, let's start with you. Just give us a 30-second rundown on your career.
On my career, 30 seconds. Wow, it's been very varied. First 10 to 12 years spent 100% in the NHS, and actually became very disillusioned with that because it was quite frankly soul destroying. So thank goodness found the private way of doing things. Wanted to concentrate on quality, not quantity. And from there I left the NHS completely and have worked in private practice ever since. And now it's a case of concentrating on developing the private skills, really. So nothing specialist, I'm a specialist generalist. And yeah, that's where we are today, just concentrating on high quality work, looking after people and their needs, and enjoying teaching as well.
So what would be your advice to someone who's in the NHS and wants to get out of it or wants to do more private work? What would be your advice for someone who's in that situation right now?
I think a lot of people don't feel that the NHS patients and NHS practices allow them to practice private work, and I don't think that's true. I think if you have the time to talk to your own patients, your existing patients, because you've already built that rapport with them and the trust with them, I think that's the first place to start. It isn't a case of jumping ship and walking out and going somewhere else. Yeah. And I think it's very true of any type of practice, really. Concentrate on the people you've spent a lot of effort, a lot of time building up the goodwill and the trust with.
But if I'm a young dentist, how many years of NHS should I do before I think about?
Well, that's a good question. I think in the past, when I graduated, people always used to say, "Oh, you need to be in the NHS for 10 years." I don't see that now. I think the NHS has changed so much that the learning experience is probably reduced. So I think if you're in a position where you've trained yourself properly, I think if you're there for a few years, there's no reason why you shouldn't be thinking of moving out much sooner.
So sooner than 12 years then?
Sooner than 2 years. No, I didn't say 12 years. Did I say 12 years?
Yeah.
How many years were you in the NHS?
12 years.
12 years.
Yeah.
Yeah. So then, okay, so now as a counterbalance then, Millie.
Take it.
Yeah. So, I mean, I'm still in the NHS. I graduated in 2015, and I actually, to start off with, was doing a lot of NHS work. And as you just said, Stuart, I didn't feel I could talk to my patients about private work. I maybe didn't think that they wanted it and they weren't going to listen and accept the other options that I could offer. So I skilled up. I spent more time learning, and actually I then slowly started approaching my patients with just a bit more openness. So offering all the options, and more people than I expected actually said yes. And the more confidence I got speaking about it, speaking about prices, speaking about different techniques, being able to explain it better meant that my patients started understanding it, and then I managed to offer better treatment more regularly. I started doing much more Invisalign, and really now my bread and butter is a line, bleach, bond, over and over again. And because I'm spending more time doing private work, it's actually allowed me to have more time to do better NHS work as well, because I'm not driven to hit that 400 UDAs in a month. I don't need to do that many UDAs because I've got the private there, which takes up a lot of my time, and I can spend the time with my NHS patients giving them good quality treatment, which they deserve as well.
So you've actually, your progress to becoming a teacher on Invisalign has been pretty meteoric. So you just did your first full day lecture.
Yeah.
So when you talk to dentists who are doing Invisalign, what are the common mistakes or the common misconceptions they've got? What would be some tips to accelerate someone's Invisalign?
So good question. If I tell you a little bit more about how I progressed through the Invisalign, then I think it helps to understand. So when I first did the Invisalign course, it sort of shocked me about how little control I thought I had over the whole process. And I'm a control freak. You ask anybody that knows me, I like detail. I really want to be there I'm not very good at delegating, and I'm a bit bossy. My sister's had that all her life. And I was like, I want control, I want to know what's going on. And at first I thought that Invisalign didn't give me that. So I did more fixed, and because I was like, I can control every movement. Then I spoke to my Invisalign rep, Alice, and she changed my whole view on Invisalign, and I realised how much control I could get from the Invisalign system. And I just started with the simple cases first, tweaking a couple of teeth, doing very simple movements, then getting my confidence up and moving to more complex cases. I now use Invisalign as part of full mouth rehabilitations. I'm doing much more difficult movements.
So your first piece of advice is talk to your rep?
No. Well, actually, yes. Actually, that is a good piece of advice, because I think a lot of times we see our four white walls and we don't get to speak to other practitioners on a daily basis. When you have a bigger network and when you have a rep that will talk you through it and tell you what it can do and what it can't do, then you do get a little bit more confidence. And then you start meeting more people through it.
Yeah, because look, there's a whole lot of information out there, education that reps have. And I think it's something that's not often thought about, because reps have a lot of information about stuff.
And people,
that's how it started for you.
Yeah, and dentists, we can like to play the blame game. It's not my fault, it's their fault. They haven't approached me. Well, actually, it's a two-way street, as with any relationship, and we need to be approaching them and finding what information they can give us to allow us to then move forward. So within the first 12 months, I think I'd done 65 cases.
Wow.
And now I'm teaching and part of the Aligner consulting family. And it's great. Now I have even more support than I did when I started, and it's just snowballing from there.
So clinically?
Clinically?
Give us some tips. Or from a patient management perspective. I mean,
so patient management...
Doing that many cases in that short period of time.
So a big part of it is marketing to bring new patients in, but also what I found is that during the checkup, when I had the patient lying down, I'd be like, oh, you might have some calculus or some tartar build-up here. Have you ever thought about straightening the teeth to make it easier to clean? Obviously take the mirror out, and they'd be like, yes or no. And then if they said yes, I would then approach the conversation at the end of the checkup. And these are NHS patients, that you're just converting into and offering them treatment that they actually want. They just didn't know you offered. A lot of my patients are saying, oh, you do this, but my other dentist doesn't. But most dentists can do it. It's just having the confidence to talk to their patients, to let them know that they're doing it. And then what I like to do, or what I do now, is I actually have a personal email address which all my Invisalign patients get. So at the end of the consultation appointment, the next day I send them an email saying, thank you very much, it was nice to meet you, I hope you found it useful. Here's my personal email address, please contact me if you have any questions. What are the next steps? What do you need to do now to go forward? And that has been a big change, because all of a sudden it's me and the patient working together as a team to get to their goals, not having to go through reception, wait for lunchtime, me to be too busy to call them back. In this day and age, people don't really want to be calling up all the time. They might think of a question, they just want to...
At midnight or whatever.
Yeah, exactly. Yeah. Well, I actually do tell them every time that after 11 o'clock I won't reply, and it'll have to wait till the next day. But no one takes the mickey. Everyone respects that I have a private life and I've got my own things to be doing. And
Stuart, from the patient management perspective, I mean, are you treating your private patients differently in that respect? Are you giving your patients your number, your email? What are you doing?
I don't give them my email or my number. After hearing that, it's a great idea. And for me, the biggest thing, the swap from NHS to private and looking after people properly, is time. So it's not always about having the most expensive and the most amazing equipment. It's about sitting down and listening to what people say, listen to what they want. I think there's a lot of treatment plans and a lot of treatment is done which dentists are good at, so they push what they're good at, and actually patients leave unfulfilled. And it's sitting down, listening, having a good chat, and sometimes in a very informal environment away from the surgery. For me, we have a a patient consultation room, which our treatment coordinator uses as well. It's actually quite nice to sit down with a coffee, especially for bigger treatment plans, and just, have a chat. Nothing formal. And actually, when you're in that relaxed environment, their true wants come out far more easily than if you're in a pressured clinical setting. So for me, that's the biggest thing. And little things like when you're actually talking to a patient, if they are in the dental chair, make sure you're actually giving them eye contact. Don't be looking around the room. Don't be sitting head down, writing stuff down. Someone else can make notes if that's what you need. Maybe just me, but I find that if you sit a little lower as well, it means you're not dominating and imposing yourself on the patient. Nervous patients are not hand on the shoulder. It's reassurance. It's old-fashioned care, really. Yeah. It's old-fashioned good manners and listening.
Yeah.
So Stuart, you've been demonstrating on the Mini Smile Makeover course for the whole of last year.
Yes.
And Millie, you've been helping us throughout our AACD and in the very beginnings of the course you were helping. And you see dentists going through this journey of within 2 days changing the way they look at anterior aesthetics and becoming more minimally invasive. What are the most common things that you find time and again that dentists are doing that you have to put right?
I think the most common issue I see is becoming very, very focused on looking down on a tooth. So
from different,
yeah. They lack the vision to look at all the different angles. And for me, what I've said it a lot today, is actually keep checking all your work from, if it's anterior work, from an incisal perspective. That will give you the bucco-palatal relationship. You can see the line angles, you can see all the reflective and deflective zones. So for me, it's actually it's very simple. Don't get too focused and too driven on looking down on a tooth. Make sure you're moving the head around and making sure you're viewing it from all angles. And I know that's...
So that is a big one.
I think it's huge.
Yeah.
And I think it's amazing how a small adjustment made looking from the incisal can transform the look of a restoration. Especially when you're looking at line angle positioning and thickness as well. It's amazing how if you're just 0.5 millimetre too thick compared to the adjacent tooth, it really does make it look far more dominant. So yeah, I think the biggest thing I see, that's the number one for me. Millie?
Yeah, I agree with that. And in practice, I'm always checking from each angle with my mirror. Yeah. But also I get my nurse to be checking from her angle, because where we sit and where the nurse sits is completely different, and what we can't see, sometimes we get so focused that actually we miss something. And it's nice to get the nurse's point of view, because she'll be able to see things differently. Yeah. Also involving her, because I mean, when we're brushing and sculpting for an hour and a half, she's probably like, I want to have a nap, can I have a cup of tea? And also the patient really enjoys that you're working as a team, and it's not just the dentist doing it. You're working together, you're chatting a bit, you're discussing them, and they really feel like they're getting a really special and tailor-made experience to them, which they really like. Mistakes that people make, I think some people they try to rush the beginning steps, so then they can put in all this fancy secondary, tertiary anatomy, and actually what happens is because they don't focus quite on the basics to begin with, by the time we get to the finishing and polishing, it's not quite right, because even though that's where they want to get...
Each step's predicated on the one before, right?
Exactly,
yeah.
So they're sort of rushing through, and it's almost, taking a moment, sitting back, looking at each step from every single angle, making sure you're happy before moving on, and just having that sort of discipline to check in with yourself, check in with the nurse, and then going forward.
I think for me, though, we've been on this course so many times, we've listened to Dipesh so many times, and we take it for granted, the different materials, where they go, their physical and their optical properties. And I find on the course, people have to get used to these words, and they're not necessarily new words. We're talking microhybrid, nanofill, microfill, but because most dentists just use a tube of composite, they're not even thinking on what's that material going to do for them. And so I think the biggest disconnect is that we take some of that for granted, and even though someone's been told once, it's taken me 50 times to get to this stage.
Yeah.
And it's something that, as a teacher in this situation, you've got to be aware of that even though it's been on the screen, it does need repetition. Repetition is huge.
Repetition is huge, and I completely agree. When I first started like being involved and learning about the different types of composite material, my head almost mini exploded because there was so much information I needed to sort of take in and then apply.
Whereas actually it's very simple.
Yeah, it's so simple, but you're coming at it from a completely different point of view, and that's why it's even more important to take each step so you're fully understanding what you're doing and what you're trying to achieve to get.
And we can see it. We can see it in the exercises, in the 3 exercises. Everyone's getting progressively better, and then on the 3rd one, everyone's doing amazing work.
Yeah.
And for me, that's a lovely thing.
Well, today, I think it's been absolutely mind-blowing, quite honestly. Some of the work that's been produced today, I'm actually wondering whether these people have done this course 4 or 5 times. It's that good. I'm really impressed.
Just 3 times in the last 2 days.
Was it? Okay.
In the last 2 days.
It's just amazing. And it really has. And I think that's where Dipesh's teaching comes in as well, because it's all about keeping things simple.
Yeah.
If you overcomplicate everything, then there's so much to learn. Then you won't learn anything. Your mind will just ignore half of it. So I think simplicity is definitely the key. And again, I think from what you were saying about involving nurses and things like that, one thing I do is get my nurse, if I'm sitting, playing about, messing about with things too much, I make sure she gives me a good kick under the chair. Because I think one of the most important lessons I've ever been told is that better is the enemy of best. You do your best. You try and make things better and better. And invariably, it gets far worse. So I think sometimes you need to stop.
We talk about it. We talk about Enlighten all the time, perfection paralysis.
Yeah.
We talk about that all the time. One tip, when I was a dentist, one thing I used to do was to phone up all my patients every day. Then I realized that's taking a long time. I was getting fantastic results from that. People were amazed, the dentists phoning them up. Then I thought, I'm only going to phone up 3 a day. Which 3 is that going to be? And maybe it would be the RCT or the extraction or whatever. And then, coming back to your point on nurses, I said to the nurse, you decide who to call, and you call. And firstly, it made my job easier, but secondly, her involvement in that and the appreciation from the patient that the practitioners call them, and she would say, oh, Dr. Langrudi wants to know if you're okay. And the patient would always be surprised and be happy. And the fact that she'd chosen them and she'd called them and then she'd come back, and we wouldn't even talk about it unless there was an issue. But she would constantly come back to me and say, Mr. So-and-so, we're so happy to hear from us. And I'm surprised, I gave up dentistry 8 years ago, and still, a lot of people don't call their patients. And it's such a simple thing to do. Call your patients afterwards, and we were talking about call your patients before their first visit. No one does that. No. And that's such a good idea.
Yeah.
Such a good idea.
You're going
to a new place, you're in a new place, you don't know what to expect. Practice calls you, dentist calls you. Before you arrive, was there anything you were worried about? And there's always a few things you're worried about. Is it cost, pain, whatever it is? You know, it's such a simple thing.
Do you think is it best for the dentist to do that? Or what about treatment care coordinator?
I think it's ideal for the dentist to, but if you're getting 100 patients a month, maybe the dentist doesn't want to do it, and then you outsource it to the rest of the team.
Again, it's going back to the old-fashioned values, isn't it? Trying to look after people and not just, not look at their teeth as a source of income, which unfortunately some people only focus on that. That's what I see. And I think that a lot of the new patients I see in our practice is because people are completely unhappy with the service they've been offered. Not with the dentistry, but with the service.
Right. I don't know if you guys have ever been involved with surgeons. Hopefully not. No. But often you pick your surgeon based on who you get on with the most. And it makes no sense at all.
I was just going to, just for the patient. So if I'm doing a multi-discipline case and I know that they've got their surgery on the Wednesday, then I set reminders for myself through, we use SOE, so through the SOE software, a reminder to email or text them.
Before or after?
After. And I just say, how did your surgery go yesterday?
Before would be even better.
Yeah, but it's not with me. So it's
Oh,
the
I see,
surgery
I see.
that, so that
I
an
see.
implant's being placed,
Oh,
or
I
they're
see.
having
I see, I see.
crown lengthening, or they're having their root canal with the specialist. And I
That's
just
nice.
email them afterwards. So it's not. So it's coming back to the fact that yes, you're going to see this specialist for this particular point of treatment, but I'm adding value to myself as the restorative dentist. That actually you're coming back to me, and I'm maintaining that relationship.
Yeah, very nice, very nice. Well, time's caught up with us.
Yes.
But I want to thank you guys for the last couple of days.
Thank
Brilliant.
you.
No,
Thanks.
thank you for having us.
All right, brilliant.
Thank you.